احنا دكتور عايزين حاجات نشتغلوا بيها في المستشفى. عايزين حاجات نشتغلوا بيها في المستشفى، عايزين البنات كلها تتعمل لها مساحات.
Across the globe, a PCR swab test is the preferred way to tell if someone has coronavirus. But Egypt is using a different tool, antibody testing, to decide whether frontline medical staff have the virus against international advice.
Antibody tests do not test or detect the virus.
Doctors say they were used wrongly and may have helped to spread the virus.
مدى دقة الاختبارات أنا شخصياً لمسته من أول شفت ليا.
During May and June, Egypt saw a sharp rise in the number of new cases. So what are these antibody tests and why does Egypt continue to use them? In March, the Egyptian government proudly showed ministers using a new rapid antibody test it had bought. The health ministry initially imported 250,000 of these tests to help fight coronavirus. There are two types of tests for coronavirus. The first is a PCR test, which uses a swab in your nose and mouth. This shows whether you currently have the virus. The second type of test requires a blood sample. The results show if you have had the virus. This is called an antibody test. It's this type of test that Egypt bought to use on passengers returning from countries where coronavirus was spreading fast. But from the start, the doctors noticed problems with the way these tests were being used.
أنا شخصياً لمسته من أول شفت ليا.
This doctor worked at an airport in Egypt. We are not identifying him for his own safety.
وكنت على طيارة جاية من إيطاليا وكانت تحديداً إحدى الطيارات القادمة من ميلانو. حسيت إن الاختبار ده مش واضح لأن مش معقولة يخش لي حوالي 300 راكب ولا واحد فيهم يطلع إيجابي وهم جايين من بؤرة.
Antibody tests do not test or detect the virus. What they do is they detect your immune response to the virus. And it takes days and weeks to develop that full immune response.
Here at Artron, we work for you.
The test is made by Artron Laboratories, a Canadian company that specialises in making diagnostic tests. The test is still being reviewed by Canada's health regulator, which means it hasn't been approved for use in Canada, but it can be exported. Artron Laboratories say they are highly confident in their test, which is being used around the world. They also say that it can help
to identify those who've developed antibodies and an immune response to the virus. It helps to know who's been exposed to the virus in the past.
Artron Laboratories say that this test should be used to detect whether or not you've had the virus, not if you currently have the virus, as Egypt was doing. In April, Egypt's health ministry expanded the use of rapid tests, saying that all medical staff should have one at the end of their shifts. Only if they tested positive would they be given a PCR test. We spoke to a doctor who works in a large hospital outside of Cairo, who had been given the rapid antibody test. He doesn't want us to reveal his identity.
لما عملنا الرابيد تيست انا وزمايلي الاربعه اللي معايا كلنا طلعنا نيجاتيف وطلبنا ان احنا نعمل مساحات بس هو رفض شديد.
One doctor stayed and demanded a PCR test. He tested positive for coronavirus. So the other doctors insisted on PCR tests too.
وكلنا طلعنا مساحات إيجابية وكلنا كنا مخالطين لأهالينا. يعني أنا مثلا كنت مخالط ل2 إخواتي والوالدي.
Their families all tested positive and were taken to hospital for treatment. By the end of April, Egypt's Ministry of Health said that it had carried out over 200,000 antibody tests. The Egyptian Medical Syndicate, a body that represents healthcare workers, warned the government that the misuse of these tests was helping to spread the virus.
الحقيقة إن ده اختبار غير كاشف الحقيقة لأنه له نتائج كاذبة سواء بالسلب أو بالإيجاب كثيرة جدا فلا يمكن نعتمد عليه في المخالطين من الفريق.
In June, Egypt stopped using the antibody tests at its airports, but continues to use them on medical staff.
اعتمدنا على حاجة ما كانش ينفع ان احنا نعتمد عليها بشكل اساسي ساهمت طبعا إن الفيروس يخش شوية وينتشر أكتر.
The Egyptian Ministry of Health did not respond to the BBC's questions and declined to comment.